would first like to thank Aerolase for this opportunity to speak about topics I'm really passionate about and share some of our experience with you. So we're first going to look at a small study I did a few years ago, looking at the efficacy, safety, quality of life, and patient satisfaction with the 650 microsecond Nd:YAG laser for hair removal, pseudofolliculitis barbae in dark skin types. Now, my interest in pseudofolliculitis barbae, I'll refer to this as PFB, started when I was doing dermatology, and I did a thesis on it. So I got to look at all the articles on it, and then that ended up in me writing a paper on the laser treatment of PFB in 2015. So it's something I'm really passionate about. I do have family members who have suffered from the disorder. So as you may know, PFB is a chronic foreign body inflammatory reaction to the hair shaft, and it's most common in persons of dark skin types with curly hair and curved hair follicles. Now, laser hair removal, as we know, has been a game changer for this condition, right? And we know that PFB and unwanted hair can cause significant emotional and psychosocial distress. However, there haven't been many studies looking at the impact of quality of life. And I've seen in my practice where patients, some of them can't even look you in the eye when they come to you, and even women, because a lot of the earlier studies focused on men, but a lot of women do suffer from this. And, carrying a beard is not an easy task. So, getting these laser treatments has been really phenomenal. And we know when you look at all the laser studies, they would overwhelmingly show that the Nd:YAG type laser is the one that's safest for all skin types. We've come a long way, because when laser treatment started, they weren't very safe for skin of color. So we thank God that, Aerolase has developed this platform that we can safely use in skin of color. So, when I was back in the UK in London, I worked in a chain of laser clinics where we had a number of different devices. And, so I'm used to these big devices, big chunky equipment that would often give problems sometimes with the water systems and would be sometimes uncomfortable, require elaborate cooling systems and so on for the patient. So when I was introduced to this novel 650 microsecond portable Nd:YAG laser that delivers gentler treatments with no skin contact, which is so very important, especially in this era of COVID, no messy gels, so less consumables needed, compared to traditional long pulse Nd:YAG lasers, I was like, wow, I would like to get my hands on one of these, and it has been found in previous studies to be effective and safe for hair removal. In fact, there was comparable efficacy when compared with the alexandrite and diode, with superior safety. Now, as I mentioned, this laser has been revolutionary for treating PFB, and patients who I've had patients in my practice who have had traditional long pulse lasers elsewhere, and then come and experience our, 650 microsecond laser, and they're thrilled about the treatment experience and the results with this device. Unfortunately, I get to see a lot of the side effects that happen elsewhere with the other lasers, right? So this laser really has increased my confidence in our ability to be safe and effective in treating skin of color. And we know once we can treat skin of color safely, then it's likely that all skin types can also be safely treated. So I set out to evaluate patients' opinions about the impact of PFB and unwanted hair on their quality of life. So we looked at also their opinion of the efficacy, the safety, and their satisfaction, right, with this laser for hair removal and PFB. So what we did, a questionnaire was used to conduct interviews with patients. Patients who had at least 2 treatments and who consented to participate were interviewed, and they didn't receive any financial rewards or incentives for participation in the study. We had, as I said, a small study sample of about 25 patients who were treated for PFB and unwanted hair. And we documented their Fitzpatrick skin types and treatment data from their clinical records, and we recorded this. Okay, just to give you an idea of the demographics, most of the patients were in the 31 to 40 age group. Interestingly, most of them were female. As I said, in a lot of studies with laser hair removal earlier, they looked predominantly at the impact on males. But as we know in our practices, in mine, I can speak for mine, definitely we see overwhelmingly more females opting for these treatments for some reason or the other. Okay, and in this study, I was happy that we had a great representation of skin type 6, because as I said before, once we have a laser that's safe in skin type 6, it's likely to be safe for other skin types. Most of the patients identified themselves as being in a lower to middle income bracket, and this is important when we're looking at quality of life studies to see how, you know, the impact of their other stressors may or may not play a role if there's a difference. Okay, so most patients, about half of them, just under half, had the beard treated, about half had the chin, and a few had multiple sites treated. Now, we had just under half of the patients receiving 3 to 5 treatments. Now, remember, what is ideal is that what we tell them in that pre-laser consult in terms of expectations is that and for best results, we recommend 6 treatments, usually 4 weeks apart for facial areas. For non-facial areas, an average of about 6 weeks apart. And then after that treatment, I don't like to promise permanence to give them, and especially for patients with hirsutism who have hormonal issues and other challenges, you have to manage expectations. So you always, you know, under promise and over deliver. So then after those 6 treatments, I say then you enter a maintenance phase, which may look differently for different persons, right? If you don't have any hormonal issues or genetic issues that contribute to it, predominantly, then your maintenance may look like twice a year, 3 times a year. For patients who have hormonal underlying factors, you know, like PCOS and so on, then they may have to come in, you know, every 2-3 months or so in maintenance based on, you know, their perceptions and their satisfaction. So in this study, just under half of the patients had 3 to 5 treatments. Some of them had less than 2 treatments. And usually in this case, it's a matter of, you know, affordability or you know, those aspects that may influence some of them in not following through. And then we had some of them that had 6 to 10 treatments and more than 10. So this was helpful in that we got to assess the results and compare it to the number of treatments that the patients received. And the average interval in just about half of them was the ideal 1 month. Okay, so I normally tell them for best results for hair removal, I like to do it monthly. And in skin of color, I know some people may do it a little more often. You don't want to go too often with the hair removal, especially if they have densely packed hairs in very dark skin types. And another thing that was good was that just under half of them, their last treatment was actually 12 months prior, right? So we got an idea of their long-term satisfaction with their treatments. Okay, so we know that in addition to the hair for PFB, you have the lesions, you know, the papules, the pustules, and so forth. And so we had adjunctive treatments in some cases, like topical corticosteroids, you know, PIH, which we'll look at later, is a big accompaniment with PFB. So a lot of them may have been on the hydroquinone type preparations at one point or the other, topical antibiotics, topical retinoids, benzoyl peroxide. Okay, so how we did it, usually I advise them to stop topical treatments 3 days prior to laser treatment. I know that there are some practitioners that may feel more comfortable saying, okay, stop retinoids a week before, but I find that it hasn't been that necessary. There are actually some persons that go straight through with retinoids, but I don't take that chance. I say at least 3 days, I find is fair enough. And we use, of course, the portable 650 microsecond Nd:YAG laser. We obtain clinical photographs, always with informed consent. And we gave the patient the option of pre-treatment with topical anesthetic, but usually they don't need it. And they opted for ice instead. Now, some persons don't use the ice. Again, we like to add that added level of comfort, give them that spa feel, and, you know, just be honest. Caution. So we always use ice packs, just a simple ice pack, and we cover it with a glove to be hygienic. Okay. So prior to the treatment, we always clean the areas with a gentle cleanser. We don't want anything exfoliating. And the area is usually marked with a white pencil and gently shaved if necessary. However, the patients were informed that they could have shaved the day before, you know, laser treatment, or a day or 2 before. Now, during the treatment, the entire area was covered with 1 pass. I like to err on the side of caution. Some persons like to go for a lot of overlapping. Again, if you have a very dark skin type with densely packed coarse hairs, you don't want to do too much overlapping. So it's best to try, in my opinion. We haven't had drama and, you know, a lot of side effects and stuff. So we, we are on the side of caution. So we tend to avoid a lot of overlapping for hair removal. And again, we use ice to cool sections of the skin immediately pre and post whatever section of the skin that we're doing. Okay, so typically speaking, and you may see different protocols in the you know, Aerolase laser booklets, and you may have had different experiences, but this is what we found in this group of patients. Usually, for best results, we use fluences of 21 to 25 joules per centimeter squared, right? Now, I would add, if you have a very dark skinned patient with, again, thickly, densely packed, thick hairs, then it's probably safer to start at 18, which is like you're setting 5 with the 6 millimeter spot size lens. And we normally are comfortable with a repetition rate of 1.5 hertz because you find the treatments would drag on if we go much slower. Now, for patients with skin type 6, we got up to a maximum fluence of 28 joules per centimeter squared. And that's like you're setting, power setting 8 with the 6 millimeter diameter spot size. Now, in patients who have, you know, fairer skin types in the study, like if skin types 3 to 5, they were gradually increased to a maximum of 41 joules per centimeter squared with a 5 millimeter spot size. And you find as you go along, as the hairs get thinner, you need to get stronger with the fluence for best results. Now, immediately post-treatment, we used aloe vera gel. We, again, erring on the side of caution. I usually apply a potent topical steroid to my PFB patients post-laser, and sunscreen always. Sunscreen is applied, right? And our topical steroid would be like a betamethasone or so. Now, test spot treatments, we routinely do this. I know, you know, some persons may have different practices, but again, we try to err on the side of caution. We do test spot treatments, usually administered at that initial pre-laser consult and immediately after treatments, in anticipation that the next time we may want to go a little stronger as the hairs get thinner. And what you expect to see is that you get a 10 to 20% reduction on average with each treatment. And after about 6, you get usually over 80% reduction. So again, we found just that, which is in keeping with other studies in the past, that in general, the higher the number of treatments the patients received, the greater the extent of reduction of the PFB and the perceived long-term hair reduction. So this table shows just that. For persons who had, you know, just a few treatments, they got mild improvement, and the improvement got better the greater the number of treatments that the persons had. All right, now I apologize if the magnification makes the pictures a bit blurred, but you know, we can see that these patients definitely had a reduction both in their PFB lesions and in the unwanted hair. This patient in particular, this was like after about 3 treatments, you know, she kind of stopped me after, and she's like, I want to tell you something. She said, Doc, I just want to let you know that these treatments have changed my life, and she had tears in her eyes. So, you know, it's really, really impactful when we can make them feel better about how they carry themselves. Again, this patient, you know, you can imagine the emotional toll on a woman to have to, you know, wear a beard like this. And so this was, you know, after about 7 treatments or so, she was so very happy. And that, you know, ability to go without thinking about hair for a while is really, really fulfilling. This is another patient after 2 treatments. This is a patient after 2 treatments. She was like, wow. My therapist in Kingston, another clinic, she did 1 treatment and got this fantastic improvement, and she did not use any topicals, just sunscreen and gentle cleanser at home. So she was ecstatic. And of course, she's since continued. All right, so generally what the patients found was that the treatments were comfortable. 84% reported no side effects. We had about 2 patients with temporary irritation and 2 patients who had temporary dark spots, which resolved by the subsequent treatment session. And these weren't true PIH, but more of a crusting. And on further questioning, we found out that in these cases, the patients didn't admit to using like an exfoliating cleanser the morning or the day before. And so this increases the risk of irritation. Thankfully, no long-lasting no traumatic, results for them. Okay, so zooming in a bit more on the impact on quality of life. All right, I know the graph is a bit busy, but if you would look at the self-esteem, you'd see that there was some impact on the self-esteem. That's the light blue column. Less so on the daily activities, even less so on their personal relationships, and much less so on their occupation. So what we found was that 60% of their PFB lesions and or unwanted hair had a moderate to severe impact on their self-esteem prior to starting laser treatments, right? And the impact of PFB and unwanted hair on their self-esteem varied similarly across all socioeconomic classes in the study. And most patients said that their self-esteem improved, and we could see it, after doing laser treatments. They whip out the lipstick and, they have a pep in their step, and it's really fulfilling. Now, 44% of them found that their condition had a moderate to severe impact on their daily activities prior to laser treatment. And 52% stated that their PFB and unwanted hair had no impact on their personal relationships. However, about a third of them did have a moderate to severe impact on their personal relationships prior to doing the laser treatments. The vast majority, 88% of these women, mostly women, said that their condition did not have an impact on their occupation. That's interesting. That may not be so for women, but I'll tell you, my experience with my male patients with PFB is that the vast majority of them have issues at work. In fact, their PFB exacerbated at work because of this cultural requirement, especially those in the like soldiers, policemen, also in the tourism sector. A lot of them are required to have this clean shaved appearance. That isn't very practical for for men of African origin, because a lot of them suffer from PFB. So in those cases, I found it affected their occupation. And in an earlier study in about 1981, it was documented that about 36% of those individuals had their occupation affected by the PFB. And there are actually studies back in the day showing a lot of racial tensions in the army with this whole requirement to shave and PFB. So the laser is definitely revolutionary. All right, so getting back to this study, the overwhelming majority, about 92% of patients interviewed, said that they would recommend the 650 microsecond Nd:YAG laser treatment to others. And overall, most patients were very satisfied with their results. So in conclusion, we found that PFB and unwanted hair had a negative impact on most of their self-esteem, daily activities, and some of their personal relationships. And so we alluded that definitely these conditions can have a negative impact on the individual's quality of life, right? Now, most patients experience improvement in their self-esteem and quality of life after having had laser treatment. So we felt good that we had something meaningful to offer. Patients found the treatments with the laser to be comfortable and safe. And so this laser has been shown to be safe in yet another study, convenient and effective in treating these conditions in dark skin types. And as I said, most patients were very satisfied with the treatments and would readily recommend this to others. So not only are you improving their quality of life, it's a business sort of generator, a lead generator, in that word of mouth is going to be your biggest lead generator. When they tell their friends and their friends, we find that because in our intake form, we actually ask them, how did you hear about us? And most persons, it's word of mouth, followed by social media and the internet and so on. So let's look a bit at the technology. How are we accomplishing this? All right, so as we know, this laser, I don't know how they did it, but I'm glad they did. It's the size of a briefcase, as you know. It can be a carry-on. It is portable. So if you want to take it to different rooms or take it to another country, another state, you have that luxury, right? And I mean, I have had my first laser in 2011, I got it, and the second laser about 2017 or so, and I've had zero issues in terms of any problems developing with the laser, and that is phenomenal, because I remember my days back in England where we always had to be calling the service guys for one problem or the other. with the bigger, bulky lasers. Anyway, so we know that the wavelength is 1064 nanometers, which is deeply penetrating. It's a quick pulse duration, and the 650 microsecond, as we know. The beam is collimated, meaning we know it's one wavelength, but it goes straight down. It doesn't diverge when it hits tissue. And the chromophore is selective, which we know this is the whole point of laser treatments. We want to selectively destroy our target while sparing the surrounding skin. Okay, so this is a diagram of the skin, and it's giving you an idea of the depth of different lasers. We know that melanin, which is our primary chromophore or target in laser hair removal, absorbs light best between the 600 and 1100 nanometer wavelength. And we know that in practice, the common lasers that are used for hair removal are your alexandrite, the 755, diode, and Nd:YAG. But as I said, you see the Nd:YAG goes deepest, and it is safest for all skin types. Okay, so what's really cool about this technology is that because of the delivery of the powerful energy in a quick pulse, it gets there shorter in a time shorter than what we call the thermal relaxation time of the target, or the time taken for the target to lose 50% of its heat, right? So that if you look in this diagram with the short pulse duration, it doesn't have enough time to diffuse to surrounding tissues. But when you look in this circle with the longer pulse duration, you see that with longer pulse durations, it can diffuse to surrounding tissues, cause pain, cause drama, cause problems, which we don't want, right? So the combination of a high power in a short pulse makes this treatment safe, effective, and tolerable. And again, repeating some of these points, because of this collimated, beam, it can go deeper, as we see in this diagram, and it doesn't diverge. So it doesn't matter, which is really cool, making it very user-friendly. It doesn't matter so much the distance of the handpiece from the, especially with the 6mm lens, from the skin, and the fluence remains fixed regardless of the handpiece distance. So this is very user-friendly. All right, so as we know, these are the three main chromophores or targets for laser treatment in the skin. We have water, melanin, and hemoglobin. And the cool thing about this laser as well is its versatility, as we know. Okay, so by targeting different structures, you can address a number of conditions: fine lines and wrinkles, sagging skin, sunspots, melasma, PIH, hair removal, and vascular conditions as well, by just changing the lens and modifying the protocol. All right, and again, this diagram suggests that because the laser's beam penetrates, it covers, it goes through the epidermis, goes down into the dermis, we can target both epidermal issues and dermal issues as well. All right, so as we know, you have the ability to do medical treatments as well. You know, again, adding to this versatility, I can't think of another device that gives you this level of versatility. For patients like, your psoriasis patients that may not want to do, all the oral treatments and stuff, this is an option for them. I had a patient who, she was like freaked out by a previous experience with a plastic surgeon that removed a periungual wart that she had, and it grew back. And the surgery, the pain, she just was like, I am not doing any surgical treatments again. And so I introduced her to the laser. She thought about it. We did like 2 treatments, and she is a believer. She thinks I'm the best thing since sliced bread. It was very tolerable for her, and she was very happy with the results. Okay, and then we know that a lot of the indications for the laser treatment are chronic. So, again, it is a practice builder. And it's not just about making money, but you're increasing their quality of life. You're making them happy. So it's a win-win situation. Okay, so what else helps to empower our patients? PIH, especially when you're talking about skin of color, right? So I'm going to show you this case with a combination treatment of PIH, post-inflammatory hyperpigmentation, with this laser. So we know that PIH is hyperpigmentation caused by any prior inflammation of the skin, be it post-infection, post-acne, post-allergic reactions, eczema, post-procedures, right? And this is what, of course, we want to avoid. It is most common in darker types. In fact, among studies done here in Jamaica and in the US and elsewhere, we find that pigmentary disorders feature about second or third in terms of the how commonly it presents to a dermatology practice. So we know it's a very, very, very common problem, right? And what we find a lot in our practice is that the patients are freaked out more about the PIH than the underlying problem that caused the PIH. Now, so what happens is that we have mechanisms that cause either epidermal and or dermal melanosis, which is increased melanin production. So when we have inflammation, we know that triggers our inflammatory cascade, releasing inflammatory mediators, and that has different effects. One of the effects is that it increases melanin production. Another effect is that not just increasing the production of melanin, but increasing its transfer from the melanocyte to the keratinocyte. Now, and this is in the epidermis. When we have that deeper inflammation that affects the basal layer of the epidermis or the basement membrane area, what we have, as a lot of you know, is pigmentary incontinence, where the melanin drops deeper, is engulfed by macrophages, and we term this melanophages. And this, as we know, the deeper it is, the more stubborn it is to be treated by just, topical creams and even chemical peels. We can't go too crazy and too deep in the darker skin types. So the laser comes in as a helpful option in treating these patients, particularly with the deeper pigment, in combination with the other things to help as well with superficial. So we know that PIH, just look at this. Of course, a lot of patients try to self-fix their condition, and unfortunately, the picking of the skin causes a lot of the PIH, so I really try to advise my patients. I know you want to get rid of the bump, but do you want the spots, so I tell them, before you pick, ask yourself if you want to create a spot here, you want to create a spot there, work with me so that we're not fading spots and bringing spots. So I try to make them a believer. So we know that it can cause tremendous embarrassment, psychosocial stress, and reduce the patient's quality of life. In fact, a study done in 2017 showed that PIH affected the quality of life significantly when compared to the main condition that caused the PIH. As I was saying, I see this every day, but I have to let them know we have to treat them simultaneously. We can't just go after the PIH and not go after the acne. And we know that the Aerolase laser can also help with acne treatment. Okay, so again, some of you may be very familiar with these treatment approaches. We have to, as I was just saying, reduce the underlying inflammation and reduce the risk factors. Now, in cases where the PIH is caused by, let's say, eczema, right, atopic eczema, we have to be very careful, okay? You can't go put in a topical lightening agent on active eczema. We need to treat the eczema first, then we tackle the PIH. But in case where you have the, let's say you're treating acne, where you have acne and PIH, you can treat them simultaneously. And even with the laser, as I mentioned, it gets at both the active acne lesions as well as the PIH, right? So my preference, and I know people differ in their approach, again, I don't like drama, I don't like problems. I tend to err on the side of caution, right? Happy life. So I tend to avoid abrasive cleansers initially, in particular, when treating PIH for skin of color, because some of the treatments I'm going to prescribe do have the potential for irritation. So I don't want everything to be exfoliating, the cleanser exfoliating, the toner exfoliating. They may have sensitive skin, it's a mess. So it's best to err on the side of caution, in my opinion, and start with a gentle cleanser when you're just introducing stuff. As they go along and you review them, some persons may get away with a hydroxy acid cleanser and so on, but I don't start there at all. Sunscreens and sun protection. This is where we need to really spread the word and do better at effecting change, because as you may know, in my experience and in studies, we see that sunscreens are still not as popular as we need them to be in skin of color populations. There's this myth that either the sunscreen would make them darker, they don't like the look of the white chalky of some of the preparations, or they feel it's something that's for fairer skin types and not them because they have melanin. But we need to just spread the word that sunscreen is for everyone, in addition to protecting against skin cancer, which everyone is at risk for. I know to greater and lesser extents based on the skin type. It also helps to reduce aging and helps to reduce PIH, and it's a lovely and necessary complement to our laser treatments, right? Now, what we're finding more and more is that, traditionally most sunscreens focus on UVA and UVB protection. However, we are finding more studies showing that visible light is a big contributor to our pigmentary disorders like PIH and melasma. So we're now moving to where we need to be advising that they get sunscreens, not just the mineral ones only, but ideally the mineral tinted ones with the iron oxide added. And these are just two preparations that, that have this. So again, I can't overemphasize sun protection. I tell my patients, look, just like you get up, you brush your teeth and all that good stuff, have that attitude towards sunscreen, even on a cloudy day, right? Especially we're here in a tropical climate. All right, so skin lightening agents, we know this is a topic in and of itself. There are a lot of agents that we can use, but we know, of course, the hydroquinone and the triple combination creams tend to be our gold standard, right? And we have other treatments that can also be incorporated, like microdermabrasion, chemical peels, dermal microneedling. I don't use this primarily for PIH, a lot. I know there are studies that show improvement with PIH, especially refractory melasma with dermal microneedling. But where I would incorporate this is where I have acne scarring or aging skin. And if they have pigmentation as well, then I'd throw in some, say, tranexamic acid solution along with the microneedling, but as an adjunct, right? And then lasers, which we're going to focus on as well. We know that there's some lasers that are out there to help treat PIH. But really, the 650 microsecond laser is the safest thing doing so. Because even if you look at the studies where the Q switched and so on, they have higher levels of side effects. And I don't ever want to have a patient come to me with something like hypopigmentation from lasers or really bad PIH from lasers. So, I prefer to have a device that keeps me on the side of caution. Radio frequency can also be used. Cover up cosmetics may be important while we're getting there with treating the PIH. And let's not overemphasize psychological support. We have to, in getting to that patient satisfaction, we have to be in tune with the mood of our patient, what they're going through, and just be empathetic and supportive. Now, combination products, as we know, tend to be more effective than monotherapy. So again, hydroquinone is the gold standard, 2% to 10%. I find more effective. I don't use it as a standalone, but in combination with the retinoid or a mild to moderate corticosteroid in your triple combination type creams. Here I get to do compounding, from the pharmacist, let them compound the preparation. So I get to customize a lot. So for my average patient with facial PIH, I may use, let's say, a 4 to 6%. For very dark skin types, because I'm not trying to bleach their entire skin, I may start with a 3%, but let them know, okay, this is going to be a bit slow, but we're erring on the side of caution. For patients who need a little speed, I may start at a 4%, but sometimes we have to take it, of course, to 5%, 6%. There are few cases where I may go to 7 and 8 on the face, but I don't like to get too high on the face. For non-facial areas, we need to go higher, usually in my experience, so like a 6% to a 10% preparation. And we know that over the counter, for those of you who use over the counter stuff, you have like your 2% and your 3% hydroquinone preparations as well. Topical retinoids and hydroxy acids. We know there are a lot of adjunctive skin lightening treatments for spots, the azelaic acid, kojic acid, and there's some studies that show combination preparations like the pigment correcting cream, discoloration defense, and so on, that may have in things like tranexamic acid with niacinamide, kojic acid, and so forth. Some of them have shown comparable results with 4% hydroquinone, but I haven't seen studies of them comparing them to the triple combination, which I would still give the edge, the triple combination cream. And indeed, studies have shown that gives superior results, right? And Yeah, and then there's this last one. I'm not going to attempt to pronounce it, but the other name for it is thiamidol. That too has been compared with 4% hydroquinone in studies and showed better results. I don't think it's yet available in the US, but it's in other some other countries. Okay, so the 650 microsecond Nd:YAG laser has been found to remove both dermal and epidermal melanosis in patients of all skin types in combination with a chemical peel or hydroquinone, right? And as I mentioned before, this laser penetrates deeper than the Q-switch Nd:YAG and has a much shorter pulse duration, adding a greater margin of safety, reducing the risk of burns, hyper and hypopigmentation. Again, it doesn't make sense if you get fantastic results and you leave them with a big side effect. You know, these things can make or break your practice. Of course, God forbid, if it happens, you have to hold their hand and take them through it and know how to fix it, right? You know, I'm thankful for the opportunity I had Dr. Wendy Roberts invited me to collaborate with a number of, you know, of other colleagues, Dr. Cheryl Burgess, Dr. Michelle Henry, and so on. And we were able to put together recommendations for those of you who haven't had a look at this supplement published last year, April 2019. I would recommend you have a look at it because we give practical advice on how best to use this laser in skin of color, and also just general treatment tips for a lot of these common skin conditions that we see in skin of color. Okay, so one of these cases that was in this supplement is a case report of a patient with PIH in which we demonstrate the efficacy and safety of treating PIH and scarring with the Neo Elite in combination with a chemical peel and medical treatment. So a 22-year-old skin type 6 patient, she had acne, scarring, PIH, and she was on initially tretinoin 0.05% cream and a combination of 4% hydroquinone, 1% hydrocortisone, and ascorbic acid on alternate nights. And in the morning, she used 5% benzoyl peroxide, a combination product with 5% benzoyl peroxide and 1% clindamycin gel, and sunscreen in the day. And she got okay results. You know, her acne improved, but the PIH was a bit slow, and she didn't want to get too high with the hydroquinone preparation in terms of the concentration. So we whipped out the laser, you know, and that really changed the game in terms of the efficacy. She first did 2 passes with a 6mm spot size at 21 joule per centimeter squared. That's your setting 6. And then her second treatment, about a month later, we had 2 passes, same thing, 6mm, 21 joules per centimeter square. And then on the scars, we went up to a 2mm spot size, but at setting 2, 64 joules per centimeter squared. Immediately after the last laser treatment, we did a combination chemical peel with salicylic acid, lactic, citric, kojic, and hydroquinone. This is the Miami peel that was performed. And her topical medications were discontinued 3 days pre-procedure and resumed 5 days after procedure. Her results were assessed with clinical photos, and her very high patient satisfaction was also noted. 2 weeks after the laser and chemical peel, she reported significant lightening of the PIH with visible clearance 6 weeks post-procedure, and she was very happy with her results, which were maintained because she's a student that studies abroad. So I got to see her 9 months after, and also recently, you know, she still had her results and doing very well. So this is her picture, and she was so happy. All right, and this is a photo by Dr. Cheryl Burgess. She successfully treated PIH caused by IPL. Now, I never advocate IPL being used above skin type 3. It's just begging for disaster, in my opinion, right? But thankfully, she was able to treat it with, you know, hydroquinone, Jesna's peels, and the laser as well, right? Now, this is a patient by Dr. Talia Ferro, who was treated again successfully for PIH, and she did chemical peel along with the laser. Okay. All right. So we would look now at some data from the 2019 Medical Spa State of the Industry report, where practitioners were asked, what are your biggest opportunities facing your non-surgical aesthetic practice today? And about 41% of them said adding a new device, adding more services, adding procedures. 40% of them said growing their practice, and 18% said having a strong brand, strong reputation, customer loyalty, and 17% advances in technology. So thankfully, I would say, and I don't just speak fondly about things unless I really believe in them. And I can tell you guys, the Aerolase laser was one of the best investments I've made in my practice because of the safety, versatility, and the efficacy and portability, and and great customer service. But definitely, this affords us the opportunity to add the new device, treat a lot of procedures, give you that confidence that say, yeah, I can handle this, I can do that, we can get these results. Having a strong brand, right? So remember, your patients, your clients, they're going to be your lead generators, spreading word of mouth, and showing that you're cutting edge. Now, in this report, they were also asked, what are the biggest concerns or issues facing your non-surgical aesthetic practice today? Of course, competition, right? 27% said competition. Getting customers, keeping customers, staying up to date. The decision to incorporate new treatments again, was an issue. And again, we see that when you have a device that can give great results, you have great customer service, and it's a winner, right? You don't have to be bogged down competing so much in price when you offer that level of service and you have a great device, right? This can help definitely grow your practice. So we know that medical spas, if we look over the years, and whether or not you call your practice a medical spa or whatever, the medical spa industry has will double in the next 5 years, and we see over the years it has almost increased exponentially. So we know competition is fierce. We have to be on top of our game, offering our best service and putting our best face forward. Okay, so some of you know this, a lot of you know all of this already. But just to share some strategies that have helped us and I've found over the years is that, the medical aesthetic center should have a clear concept, right? You do you. You know what concept you're going for and be true to it. So for us, image and experience is key. We wanted to create a relaxing, soothing, comforting atmosphere. And I would share with you when I just, graduated from dermatology and making my plans, doing my business plan. I was old school, had this big notebook, and I actually wrote down the adjectives that I wanted patients to tell me on entering the practice. And let me tell you, when I actually got to do it the way we wanted to, we had a blank slate and got to design it and, see it come to life. It was so fulfilling to hear the exact words being conveyed by patients. They're like, Doc, I feel so relaxed. I feel like I'm in Hawaii because, we give attention to detail. It's clean, professional. We try to arouse the 5 senses of the clients. So your decor, your lighting, your music, your color, your scents. So we have traditional, because we're in the Caribbean, we have traditional steel pan instrumental music playing all the time, and then we have the scented plugins that give tropical fragrances. So we dim the lights are usually a bit dimmer than this in the common waiting areas and so on. And so once they enter, they just feel like they can just leave the cares out there. We know we're post-COVID, so of course we have our protocols. You're not going to have a packed waiting room and so on. But still, you can stay true to your brand. Offer the drinks, refreshments. These are what patients expect as, definitely as part of the package. All right, so these are just some more pictures of how we did it. We like earth tones and so on. This is my office area, examination area. This is another section. So we have 2 adjoining shops or suites. And this, again, picture was taken pre-COVID. Post-COVID, we have less chairs in that area. And we have a teaching area as well. Okay, so yeah. And of course, that it's important that you ideally have a balance of medical and aesthetic staff under one roof if possible. And I can't overemphasize this. You guys know this already. Attitude, image, and passion is key. We need to be happy, smiling, willing. This is something that we always is non-negotiable. Now, it's even more challenging because we're all wearing masks and, you know, the eye shields and the works. And so how do you convey a smile, right? Your body language is key. A lot of our nonverbal communication is in our body language. So we have to keep training our staff to convey that warmth, even in their body language, even in the eye contact, even, you know, exude confidence. So interpersonal communication is key. I try to, you know, let our staff know, and they know that everybody is treated like a VIP. We display our core values, our mission statement, our vision statement. So our vision statement is creating complete wellness, skin, body, and mind, right? Exude competence, confidence, be a team player, have positive energy. Listen, reassure the clients and patients. We all have rough days. We're all stressed out with COVID, but we still have to be on top of our game and offer the best service that we can. Offer a combination of medical and spa packages. And of course, the sky's the limit in terms of your creativity, but remember safety as well, right? As we know, a consultation is very important to identify the needs of the patient, their suitability to treatments, informing patients about the treatment options, recommendations, discussing pros and cons. So like for our laser consult, that's free. For my dermatology consult, you know, that is a paid service, right? And the laser consult, my therapist would do that. So provide a comprehensive mind-body approach to treating to the patient or client. Again, let your staff be in tune with what's going on with the patient. I always hire on personality mainly. Yes, skill is great and they have to have some skill, but skill you can build on, skill you can finesse. If the personality isn't there, it can be, you know, it really can be detrimental to your practice. It's really hard to train character, train personality. So when you have a people person, that can be, especially at your front desk, that can be like a game changer for your practice, as you probably know already, of course. Provide a balance between your medical and spa therapies to cater to the patient's and client's comfort and well-being. And, you know, find ways to reward patients, you know, especially in this era, especially your top ones. So keep track of your top patients, like let's say your top patients of the month. Offer them a free service or a free add-on. You can do a referral reward where they, you know, if they refer a patient, they at their next treatment and the new patient get like say a 20% discount or get a free add-on or something for that one treatment. Some of you may not want to get too much in a discount culture because then the patients may always expect this. So, you know, you have to manage it. We like to do a lot of stuff around Christmas time. So we may have a 12 days of Christmas sale or whatever, you know, you can be very creative. Okay, so what do our clients and patients require? Again, they need for the effectiveness and the benefit of the treatment to be clearly defined, right? It needs to be beneficial for the health, obviously, and not harmful. So don't take chances. Don't be a cowboy, you know. Always, no matter how many years of experience you have, always are on the side of caution. They need us to be high, you know, have a high quality and competency and absolute customer orientation, absolute service attitude. So sometimes it's not what we say, but how we say it. So if they have a concern, they don't care how we fix it. They just need it fixed. You know what I mean? So we always try our best to treat everybody like a VIP and meet their needs, meet them where they're at while not betraying our safety, right? They want appropriate price performance ratio. So they must see what they're paying for and they must get what they're paying for. So again, if you offer a great service, people see you as the best in your area, you don't have to get bogged down competing too much on price. But of course, you know, within reason. And patient client health and safety should never, ever, ever be compromised for financial gain. So you have to recognize that patient who you know, is going through, say, a rough divorce or something, and they just want the kitchen sink thrown at them. They're not going to remember, you know, sort of pressing you to do it all when things go wrong. So you still have to sort of guide them in the safe ways of doing things, right? And again, you know, you have different promotions and so on that would keep your patients excited and interested and get new patients going. So again, to reiterate some of these, here are some quick tips to jumpstart in your practice. Have your before and after photos visually displayed. We have a monitor in the waiting area that keeps rotating. We also have the Aerolase booklet with their before and afters and stuff. And in your office, of course, you highlight your credentials, display the technology, the Aerolase technology. Ask about, so we have in our patient intake form what we call a welcome letter. So we do this, you know, nice fancy welcome letter where we welcome them and tell them all about our services, get their demographics and so on. But then we also give them an opportunity to take things that they may be interested in. So that's another way. They may come for one thing, but then they may see, oh, they do this as well, and they may get interested in that treatment as well, or just express that, oh, this is something that really bothers me. Now, and be ready to start treatment the same day. Of course, know the treatments that you're not going to start the same day. So like, ideally, I prefer to prep for my chemical peels. Yes, you can come in and just do a peel, but the results are better when we have that prep with the retinoids and, you know, the pigment lightening stuff and so on. Okay, and of course, I can't overemphasize this. Have a happy environment with a warm yet confident staff. Again, we have to keep our staff motivated because even if we're tired, we just want to give of our best and have a sort of family atmosphere. So people feel very comfortable and as if, you know, they're coming somewhere where they can just throw their cares away. Okay, and then it's very important that when treating skin of color and anybody that we safely stage our treatments. So discuss the plan, know the treatments that you can safely combine, know those that you know would want to then separate out and so on. So for instance, when we're doing our peels, as we see here about bundling, right? When we're doing our peels with our lasers, we do our peels after the laser, right? And if they've had a chemical peel, we don't do laser in skin of color. We wouldn't do laser for a month just to be on the safe side. If you push it, maybe you can do it 3 weeks, pushing it 2 weeks. But again, I don't like to push it too much. I like to give a lot of time for that skin to recover. But you can do the chemical peel right after laser. For the microdermabrasion, we tend to use the multiderm microdermabrasion mostly in our practice, which isn't as abrasive as the traditional crystals or diamond tip, right? And it's a big paddle that we only use on one client, you know, so the paddle can only be used on one patient. We have to discard it after that or save it for another treatment on that patient. So that's gentle, and that's another indication for that is a pre-laser treatment. So microderm we do pre-laser. And of course, you know, products can be bundled. Social media, you know, need I say more? That's where everybody is at. And so, you know, one of our limitations here in being in a small town, some patients don't want the pictures out there, even if you hide features. So not every patient, and I have to have my patients sign, of course, to give me consent to share their pictures for marketing. So I wish more of our patients would not be as secretive, but if you have patients who don't mind and you do a lot of before and afters, you display them, you know, and link other practitioners, link Aerolase and so forth. So this was really heartwarming. This picture on Instagram, I stumbled across it when I saw, she said, Dermatology Solutions did this to my skin. And she's like, #flawless. And you can see her smile, you see her confidence. And this is what makes what we do worth it, right? And so, you know, as I said, you always just give of your best, under promise, over deliver. So patients would come and they would be like, Doc, I heard you're the best and this is that and and I'm like, well, I'll try my best, you know, and we just try to treat everybody like we'd like to be treated, and then the reviews would speak for themselves. And again, that's a great lead generator. So in summary, the Neo is a great way to grow practice and to aim high with state-of-the-art technology, be a provider who's comfortable with skin of color, and work more efficiently, right? Balance what you enjoy doing with profitability, okay? And market to your patients and their families as well. You know, as I said, they would spread the word. All right, so just to share with you a bit more about my journey too. So I mentioned that I got my first laser in this picture with me in the red and white dress in April 2011. What was kind of sentimental and nice is that 8 years later, April 2019, based on a Facebook memory, I didn't even realize it was the same day that exactly 8 years later was when I got, you know, when I heard that our article was published, and I was privileged to collaborate to tell other practitioners how best to use this laser in skin of color. So that was very sentimental. And now, thankfully, after, you know, taking the leap, we have another laser, which I'm so glad we made that decision, because right now, as you may notice, traveling isn't much fun. And so normally I travel to St. Vincent and Antigua every 2 months for practice. Since COVID, you know, with the quarantine requirements and the risk, I haven't done that. I've gone to dermatology, but I have an excellent nurse who's registered nurse over there, you know, and I practice in another person's medical practice over there, that she now, the Aerolase laser, is carrying that practice and the other treatments that we offer. So I'm glad that I made that decision to have that practice over there and have a laser over there, right, as well. And we're so thankful. We just celebrated 15 years on September 29th in service. And so we try to keep our staff, our team members, and our patients happy and smiling. And this bottom picture here in the blue is my latest project. So I'm big on wellness. And for like 4 years or so, I felt led like I need to do some kind of talk show activity. And I made this big elaborate plan, everything planned out, but I was just too busy. Then came COVID. And I just knew this is it. This is the time, you know, everybody's going virtual, do it online. Why not? And so I started the Arise and Blossom with Dr. Arusha Wellness Talk Show. And we just did a show on overcoming depression that was really impactful. So not only are you interested in, you know, getting your patients and making money, but you really show interest in their well-being and get involved in other ways in motivating them, eh? So thank you once again to Aerolase for this opportunity to share my experience. I'm happy to answer any questions, and thank you for your attention, ladies and gentlemen.
Hey, thanks, Dr. Campbell-Chambers. Always a pleasure, and it was a fantastic presentation on all of those different topics, business, clinical, your work, and beyond that. So again, thank you very much for it. So like she said, we'll you hit the hour mark almost on the dot, so kudos on that. But we do have a number of questions if you can stick around with us.
Yes, I'm fine.
Of course. So I want to start off, we do have a couple of questions on topicals and steroids. Is it necessary to give them any sort of a topical numbing agent before you use the laser? And then afterward, with a typical treatment, either for PIH or hair removal, depending on what you're using it for, how long do you typically have someone on a topical steroid?
Okay, excellent questions. So as I had mentioned, the overwhelming majority of my patients do not need a topical numbing agent. No, you may have, if I think of I have probably 1 or 2 literal patients that have a very low pain threshold, and psychologically, they're like, you know, they want to do the numbing agent. So we offer that as an add-on service, but the overwhelming majority don't need it. To answer the other question, with the topical steroid, usually it's under a week to those areas. So under a week, based on, I tell them, just for those areas that may get, you know, with some bumps after, just to calm those down. Often I would prescribe a combination of, we call it here Fucicort. I don't know if it's Fucibetin. I don't know if you have that, but Fucidin and betamethasone is what I tend to use. And that's usually fine, because of course we don't want them on the steroids for too
long. Okay, and then in terms of using either peels or topicals in conjunction, especially for PIH, you went over that a little bit. One was the Miami peel, I believe.
Right.
Is that something that you come up with, or is that a trademark name or a product that someone can buy?
Yeah, man, that is a trademark name. Yeah. So you know, Quintessence, I think is the name. But if you Google Miami peel, you know, you'd find their contact information. So it's a trademark name. Hope that's fine for this presentation to mention brand names. I try to avoid, but just being practical. Yeah. So you mentioned as well topical. So most of my patients with PIH, how I do it is a stepwise approach. Most of my patients with PIH will start off with a triple a compounded triple combination type cream, again from like anywhere from 4 to 6%, typically for facial areas. And then I would offer them, so I may review them after like about 2 months, give it some time, see what's going on. It depends on the patient, and then I can offer them the option of adding in the laser and peel, or we progress to that based on their results. So it's usually a stepwise approach. We go to peels, and then we can add lasers too, of course, for the stubborn. Like in that patient I showed, we started with topical stuff and we got so far. But when we added the peel with the laser, that was the game changer. Are you with me?
There we go. For some reason I wasn't able to unmute it.
Okay, sure.
But, yeah, no, I didn't just duck out. But okay, keeping on the topical and skincare products. So skin lightening, that is something cultural that, you know, certain cultures over the world use. Some places have banned hydroquinone. What are your feelings about it? And do you think that there's an alternative out there, or do you think that's something that I think we as a people need to start stepping away from?
Okay. Loaded question, and I'll try to answer as best I can. All right. So for the first aspect, and I want to be clear because this worldwide, especially in some countries, we have a problem here. When you use the term skin lightening bleaching, we have to be clear what we're going for. I know what we're talking about, but just, you know, putting it out there. We know that there are lots of patients because of, you know, whatever, colonialism, whatever, they may feel that to have a lighter complexion is more desirable. And so we have a lot of persons abusing hydroquinone and other preparations for the purpose of total lightening. I'm not for that. So I don't advocate, and I'm very upfront about that with my patients. I say, you know, I find that because I get to see all the crazy side effects, not just from hydroquinone, but, you know, the clobetasol, you know, using the most potent topical steroid and stuff, mercury containing stuff. We get to see a lot of that drama. And so I really try to explain to my patients, my aim is to blend your pH, lighten the pH. So I'm very careful when I'm prescribing these things. I mean, they can do what they want, yes, but I monitor them to tell them that we're trying to blend the area, right? So that is, I just want to make that distinction clear, that that's my aim when I'm treating it. And also, I haven't had any problems with hydroquinone. Now, I know hydroquinone has gotten a bad rap. The studies that have shown, I think it was in rats or something, when they gave them like very, very high oral doses of hydroquinone, they had some, you know, some cancer association. We've not had any reported side effect of, you know, skin cancer in patients using hydroquinone the way we do. So some countries in Europe, I think, have used that as a reason not to ban hydroquinone, and that's unfortunate because in our practice, the way we use it, we don't see a problem with cancer. Ochronosis, I've never had a patient with the way that I've described how we prescribe it in compounded preparations for limited areas. I haven't had a patient get ochronosis from those preparations. And colleagues, when I go to conferences and stuff, they say the same thing. But we see it in the community where people get a lot of, sort of off-label type, market, on the black market type preparations that have mixtures of God knows what. They tend to get, and they're just living constantly and plastering it all over. That's where we come into a problem. So I think it would be sad if you lose hydroquinone in the US over the counter, because it has its role. Thankfully, I don't think the compounded preparations are in threat, but for patients of color, pH is a big contributor to reduced quality of life and low self-esteem. So, I wish there's somewhere we can lobby and show that the studies show that it's in the way we use it is very safe to be used. So I don't know if that answers all the questions.
Yeah, that ticked all boxes, to be honest with you. That was very impressive. So it was loaded, but yeah.
Yeah.
So actually, on a lighter subject, I do have a couple business questions for you. Now, this obviously ranges depending on where you are, how you want to do it. Pricing. Pricing is something a lot of people ask for. Is there anything special that you look at when determining your pricing, or is it really kind of just competitive?
Okay. So yeah, so initially you do your research, you see what, and it's a lot of research. First, you have to look at your particular, it has to make sense for you. You know what you invested into it. You know what it takes to, have your practice going. You know what figure you would need to be earning an hour. So you do your calculations and you can get an expert to help you on this, to help you figure out what you need, what this needs to return for you. And obviously it also has to be in line with the general trends, ideally. So it really, as you said, would depend on the area and what is reasonable. You look at, so I would look also at US prices. Even though I'm not there, I would look at our local prices, and I would come up with something reasonable that makes sense for me based on what I need to be making, to cover the consumables or my investment and so on. So sorry I couldn't get more specific, but those are the factors that tend to influence my pricing. But I would not necessarily, I'm okay if somebody offers a service cheaper than I do, and let's say I'm doing the laser treatment, my time has value. And so if they're, I can't compete with if in another practice they have somebody else, of lesser qualifications doing the things, they get what they pay for, kind of thing. So your time must have value too. And so that's why I say don't compete with price, in that you don't have to be the cheapest around, but they must feel satisfied that, they're getting what they're paying for. I hope that answers that.
Yeah, I think that's the best way to put it. I mean, everyone's going to be different, but like you said, you
Yeah.
have to have that number to stay in business. You have to have that number to value yourself and look at what you're actually doing. Is it a little bit better, a little bit run of the mill, so on and so forth. But no, thank you for that.
Yeah.
So back to actually PIH. Now, in the pediatric, children and teenagers, how do you treat PIH in this population, and are there any considerations for it?
Excellent question. Okay, so my sort of rule, I can't remember if I saw it in a study or just heard from, colleagues and so on, is that my comfort zone for treating PIH in children is perhaps over, say, 12, 13, that age group. I'm not comfortable doing too much hydroquinone and so on. So I would more tend to use gentler or more natural type products, emphasize sun protection, because we have, let's say, patients who may have an allergy to insect bites, like what we call papilla urticaria, and they get these spotty legs, particularly in skin of color. Some, like even in 2-3-year-olds, parents would bring the kid to me asking for something to fade it, and I try more reassurance and natural things like, sun protection, natural products, maybe niacinamide and so on, but nothing like hydroquinone, retinoids, none of that in that age group at all. So my comfort zone is, in adolescence and above. I'm usually erring on the side of caution for school age children, because remember here, there's sort of a stigma if you're looking like you're attempting to bleach your entire face. So tragically, even for some students who may have disorders of hypopigmentation, which is pale spots, they may be accused of wanting to fade their skin, you know what I mean? So I'm very sensitive to not letting my treatment look like they're trying to do that. So I usually go in very low strengths of the hydroquinone preparations, like even a 3% or 2% mixture, and beg the parent to please monitor it, keep an eye on it, make sure it's not overdone. And so it can be done in adolescence, but with caution, and emphasize the sun protection and so on, right? And in terms of procedures, lasers, I have done lasers in adolescence. Again, in Jamaica, the age of consent for medical treatment is 16. So under 16, the parents would have to consent. Over 16 or over, the patient, the teen can actually consent to it. And I'm comfortable. Again, this is a very safe device to use.
Okay, very cool. So that a little bit over the 70-minute mark here. I just want to follow up with just two more questions.
That's
One
fine.
is, do you have a particular case that stands out outside of what we were showing today that holds
Mhm.
a lot of value to you, or that really kind of you're very proud of?
I don't want to sound too sort of boastful, but I mean, to be honest, it's thankfully I love what I do, and we get every day we get really great success stories because I use this app to take pictures. Everybody gets a picture, and in every consult, we look at their before and afters right there, on the device. And so every day we get stories of patients who they're like, oh my goodness, just yesterday, there was this patient. Oh my gosh. When those patients come into you, she was unfortunately being prescribed a lot of topical, strong, potent topical steroids, like I think betamethasone. And she was using that, treating what she thought was eczema on her face for months. And it was actually acne. So of course she got steroid exacerbated acne. And I was like, oh gosh, I felt it for her because you could see, she's like, this, she was a wreck. She's like, this is not my face. And she's a marketer. So I felt it, she was trying to communicate to me like, listen, I need this gone yesterday. And so I recognize that, and I really empathize with her because trust me, the bumps, the papules, pustules, nodules, everything was just oozing. And I'm like, you're just very empathetic, and you go through the history and so on, and you let her know. And I try really just to be very honest with them, but give them hope, right? So I'm like, okay. And I whipped out the laser very early. So I did a number of things. She didn't want to go on like Accutane or anything like that. We did oral antibiotics, we did topicals, and we did Aerolase. And, I'm like, listen, normally traditional acne treatments take about 2 months to work well, but with the laser treatments, we can speed that up and so on. And we did one laser treatment because she had really gross acne. Right immediately after, I had to kind of hold her hand because obviously stuff burst open, and so the pus don't want to gross you guys out, but you get the picture. So, all of that came out. And then I saw her, and she did a second laser treatment. And I saw her, and I think we did some extractions, facials, my staff. So again, marrying the spa with the medical. I saw her yesterday, and her forehead was clear and she was grinning. She had some PIH now that we're gonna step up on, but she was, I couldn't stop smiling because I remember how she was prior to it, and me feeling like, oh my gosh, I have to do something like ASAP for this lady. She's just devastated, and she is so confident, and she set up her appointment for other treatments to follow up. So she is happy. So that stands out. But yeah, every day this is what makes my job really happy, because you get to see, you get to show them. They don't forget, because sometimes they forget from whence they came. But when you have those before and after pictures, there's no doubt in your mind that improvement. What a treatment I love to, I should mention this quickly. For anti-aging, I know a bit off topic, but still with the laser, I love to combine the Aerolase Neo laser, and then right after, they have to have some time with us. We numb them, and they get to do microneedling and PRP, platelet-rich plasma. And then for patients who want, added volume, addressing volume or lines and wrinkles and stuff, we can add fillers and Botox all on the same day. But you do the laser first, and then we do the needling, PRP, and Botox and fillers. And let me tell you, that is so rewarding because it takes time, but usually in that 4 to 6 week period, even after one treatment, the skin texture is just like, wow. You can easily knock 10-15 years off. So that's usually a very again, another fulfilling treatment, and a way that you can combine safely a number of procedures if you know how to stage them well.
No, that's great. Honestly, that was the entirety, the underlying issue that we were kind of addressing today. So I think that's very, very, very good to round it out, both on the aesthetic and medical side.
Yeah.
So the last one, you gained a couple followers here. Where will people be able to kind of follow your ventures, and will you be doing any sort of training, or once you're able to travel, where can people find you, either across the globe or in the Caribbean?
Okay. So my practice is Dermatology Solutions, and we are in Jamaica and St. Vincent and Antigua, but our base is Montego Bay, Jamaica, right? I'm on, Facebook, Instagram, as Dermatology Solutions, and also as Dr. Arusha, Dr. Arusha. For Facebook, you spell out Dr. Arusha. And so you'll see the entirety of me. I'm not just skin, I'm big into empowering persons, empowering women, training. We actually have developed a training program, and I need to, I've done it for my staff, and I need to put it out there. And that's another thing on the to-do list in this sort of COVID era, to get more time to just put that out there. But I've done it, for my staff and so on. So we'd announce that on social media whenever we're launching the training program, and it will be virtual. We'll figure out a way for practitioners to where we could connect the devices and have that practical aspect as well as the theory. So sky's the limit, right? Thanks for asking.
Exactly. So, okay, with that, we will conclude everything. Again, Dr. Campbell-Chambers, thank you so much. We all appreciated it. Everyone stayed on the entirety of
My
the
pleasure. My
session.
pleasure. Bye, guys. Take care. And this too will pass in terms
Yeah.
of COVID and all this mess.
All right, excellent. Thank you, everyone, for joining us across the world. Appreciate all your time again. We'll talk to you soon.